So now let's get into the infection part of it. So earlier we talked about the pericardium. The pericardium is a sac that encases the heart or holds the heart. And so sometimes that can be inflamed. And so it's called pericarditis. So to have the name of it, inflammation of the pericardium is called pericarditis. Okay. So the definition, we have inflammation of the pericardial sac. So the etiology, this could be due to bacteria or fungal infection, autoimmune disorder, systemic lupus, or inflammatory response after an acute myocardial infarction. It also could be caused by neoplastic disease also. So there may or may not be a pericardial effusion or constrictive pericarditis. And what pericardial effusion is when you have fluid surrounding the heart. And I have some pictures that are coming up later on that you guys will be able to watch or see. So pericardial effusion is a fluid accumulation around the heart. So when that fluid gets too much, then it becomes cardiac tamponade, which is very dangerous. So this can occur. One of the precursor of pericarditis is that the person may have, this may occur several weeks to months after a myocardial infarction. So what am I saying? The person may have a myocardial infarction, then end up having pericarditis. So it may be acute or chronic, and it may occur at any age. So pericarditis occur in up to 15% of persons with transmembrane infraction. And so what they'll suffer is severe chest pain. It's caused by inflamed pericardium rub, where you have the pericardium is rubbing against the heart. How can you differentiate between a pericardial rub and a pulmonary rub, please? So let me explain this. If someone is having that their pericardium is rubbing against the heart, okay? Sometimes there are other rub too. There are rubs like the pulmonary rub that can occur. And when you want to differentiate, is it a pulmonary rub or is it a cardiac rub? You can't stop the heart from beating, but you can have the person hold their breath. So if you have two things that you're thinking making noise, it's either my hand is making noise or it's either my foot is making noise. I can't stop my foot, but I can't stop my hand. So if I stop my hand and I still hear the beat, that means it's not my hand making the noise because you're still hearing it. So the same thing with the lungs. You have the person hold their breath, and when the person hold their breath, if you still hear it, that means it's the heart, because the heart is the only one thing beating, right? If you don't hear it and if it stops when you hold your breath, that means it was the lungs. And so you differentiate between a pericardial rub versus a pleural rub. So finding of pericarditis. So sharp chest pain, often relieved by sitting upright and leaning forward, worsen with coughing and laying in supine position. So pericardial rub, we spoke about that. They may have even dyspnea. They may have fever, chills, sweat, dysrhythmia. They'll have pulsus paradoxus too. Pulsus paradoxus is a fall in systolic BP when the person inspirates. This is when it's greater than approximately 10 millimeters of mercury. And whole sign of pericarditis is that this person cannot lay flat. The pain is going to be more severe. So this person feels better when they're sitting up or leaning forward. So what they'll do is they will do some diagnostic tests. When they do the white blood cell, they'll find that it's increased, especially if it's caused by infectious agent. So what's the white blood cell level or range? What's the white blood cell range? Normal white blood cell range, 5,000 to 10,000. So they have something called sedimentation rate. Sedimentation rate is a marker for infection. It's not specific to what kind of infection, but it identifies that there's an infection going on. So what they do is actually spin the blood, get the blood in a tube and spin it and to see how fast the blood settles. Now, for male and female, it's different. So for female, it's 25 mm per hour, and for male, it is 15 mm per hour. So they'll show a positive blood culture if infection, nuclear antibody. So they'll do blood culture if infection. They'll also do anti-nuclear antibody if it's due to connective tissue. So diagnostic for pericarditis. One of the things that they'll do, they'll also do an EKG. And what they'll see is a change in the ST segment They'll do an echocardiogram to determine pericardial effusion or cardiac tamponade. Cardiac tamponade is like the heart muscle is sitting in a bag of water. Okay, it may show pleural thickening also. So pharmacologic treatment, because it's an inflammation, they give anti-inflammatory medication like NSAID, corticosteroids to treat the inflammation and the pain. If it's infectious, they may give antibiotic. They will want that when they recommend that people with pericarditis not avoid anticoagulants. The reason why they're going to avoid anticoagulant is because if pericardial effusion is water or fluid building around the heart, and the person take anticoagulant and then they start bleeding, it can further, because we're talking about water, it's not water from the tank, water, blood building around the heart. So if it start bleeding more, it's going to accumulate and cause cardiac tamponade. So if someone has pericardial effusion, they should avoid anticoagulant. So they'll give them oxygen if they become hypoxic, is present. For surgery, they'll do something. It is mandated that a person who has pericarditis, because they are at high risk for having pericardial effusion and cardiac tamponade, you should have what they call a pericardiocentesis kit at bedside, because what they will do, they're going to insert a needle through the chest wall to the heart to drain the fluid around from the heart. Another thing that they'll do too, for recurrent constrictive pericarditis, they'll do a partial pericardionectomy. So what they do is that they create a window in the pericardium so that the fluid don't accumulate. And if that doesn't work, then they do a total pericardectomy, remove the entire pericardium. That's the site that the heart is held in. So you want to manage pain and anxiety. You want to position for comfort. And this is semi-fold or high fold, because we did say that the client who sits up and lean forward feels much better than clients who are laying backwards. So they give mild analgesic to keep pain at 0 to 2, and other medications such as antibiotic and so forth to treat the infection. So here what we're talking about is that you want to assess respiratory, cardiovascular, and renal status 1 to 2 hours of acute phase. As you can see, this is a pericardium sac around it, and you have the heart, you have the fluid building around it, so it's like the heart is in water. So what I was talking about the bleeding is that if the person starts bleeding, then you're going to have accumulation of blood building up around the heart, which can cause cardiac tamponade. You see the water? The water builds up till it starts squeezing in on the heart, and then it cannot get a contract relax, which is a emergency, or cardiac tamponade, or some people say tamponade. So you want to maintain a pericardiocentesis kit at bedside. We said that. So you want to teach a client about the cardiac 5. You want to tell them about what test is going to be done, what's the treatment. You want to teach them also about the drug. You want to tell them about diet and restrictions such as low sodium diet. You want to tell them how to reduce cholesterol level, the disease, and also about the disease process, and also to stop smoking.